Obviously, the most concerning issue with fibroids are the symptoms that they cause. Women can be diagnosed with fibroids due to a wide range of symptoms, the most common of which are heavy bleeding, pelvic pain, pressure, cramping, and frequent urination. We'd like to break these down into the bleeding as well as the pain and pressure categories. Fibroids is a very common cause of heavy uterine bleeding. A lot of women ask, Dr. Harris, how do I know if my cycle is heavy or if it's normal? A normal woman's cycle is anywhere from 40 to 60 milliliters per cycle. You can compare this with a can of Coke, which is about 250 milliliters. So during a normal week or 5-day cycle, a woman should only bleed a small fraction of that amount. Women with heavy uterine bleeding are often diagnosed with 80 milliliters or more. So heavy fibroid bleeding can be quantified as greater than 80 milliliters. Of course, women ask, Dr. Harris, how do we know exactly how much 80 milliliters is? Well, a lot of women that see us talk about having clots form and passing clots. Within one clot, most of the time that's going to be more than the 40 to 60 milliliters of a normal cycle. So passing clots, changing a pad every hour or even every 30 minutes can be an indication of abnormal bleeding. Changing the pad several times an hour for 1 to 2 to 3 days is certainly abnormal bleeding, which could be caused by fibroids. Those symptoms of fibroid bleeding certainly should be contrasted with normal female symptoms. The other category of symptoms that women can present with fibroids is pelvic pain, pressure, and cramping. As you could imagine, as a fibroid begins to grow within the uterus, it can cause a lot of symptoms in a woman's pelvis. The first symptom that it can cause is pain. As that fibroid grows and the uterus gets stretched and pulled, that can cause pain symptoms for a woman. Also, as that fibroid presses on other internal organs, such as the nerves in the pelvis, women can get excruciating pain, especially during their cycle. As those fibroids grow, women also have more cramping and more discomfort during their cycle. They can also press on the bladder, which, when compressed, can cause urinary frequency and urinary symptoms. Some fibroids, when they grow large enough, can actually compress the colon and cause chronic constipation, or can compress the ureters and the kidneys and cause kidney problems and kidney failure. This is uncommon, but certainly still a symptom that should be considered when diagnosing fibroids.
I had excessive bleeding, which caused me to become anemic, and because of that, I was exhausted all of the time. And my OBGYN also told me that my uterus was the size of a 4-month pregnancy, and I had symptoms from that, the lower back aches, frequent urination, and I even had cravings. I just felt absolutely miserable.
I was having excessive bleeding. I didn't have any pain. It was just getting to be unmanageable.